Hello everyone, you are all welcome to lecture number 1334, and today's topic is related to SHEFALI'S death in India, and she was one of the artists and young, and it was really very much unfortunate. And according to mass media news report, what I got, on that basis it is my lecture and information to all the youth that what type of reaction and chemistry is involved. We should try to understand once we are very much cautious of our health, well-being, and of course to use lot of chemicals, lot of vitamins to challenge the aging process. So according to news, what we got, that she got sudden fall of blood pressure, and also she was on vitamin C drip. She used to take vitamin C intravenous drip just to maintain her skin health and to maintain the glowing skin, young skin. And also vitamin C is very, very important for your immune system and also to maintain your skin health. And vitamin C is very powerful antioxidant, and of course there is no risk of taking vitamin C safely, provided it is not in excess. And let me make it very clear, excess of anything and everything is bad. Even if you take excess food, it will become toxic. So what happened? The sudden fall of blood pressure is a very big question mark. And once there is sudden fall of blood pressure, means immediately blood will not be reaching to heart, to kidney, and to brain. These three places are there where blood will not reach if there is sudden fall of blood pressure. And there are a lot of papers and literatures available that once vitamin C excess is given, then this type of fall of blood pressure comes. And nowadays this vitamin C drip therapy is becoming very, very common among teenagers, and especially those who are above 30 or close to 40, because at that time skin starts aging, and to maintain the glowing collagen proper proteins, to make it shining, lot of youngsters are going for this type of therapy. And also here social media is playing very important role, and people will talk and say that I am on such type of vitamin, mineral or diet, and that's why I am looking younger and younger. So all these things are also due to the contribution of lot of wrong information by social media. For going of any medication, just to maintain your wellness, youthfulness, first consult your family doctor or those who are healthcare consultants. Otherwise it will be toxic. So what happened in this case, that what they have reported, on that basis I am discussing here. And if the report is wrong, then it is other thing. Otherwise, once she was on vitamin C drip, sudden fall blood pressure, and she was rushed to hospital, and before reaching to hospital, the moment she reached, she was declared dead. So it was massive heart failure, and this massive heart failure is due to sudden fall of blood pressure where blood was not carried. So what is happening? Once excess vitamin C is given, it will dilate the blood vessels, and when blood vessels are dilated, definitely it is going to drop the blood pressure, and once blood pressure is dropped, first the heart muscles will be affected, because your heart is nothing but a pumping machine, and to pump it needs oxygen and nutrient, and that it is getting through blood. So once blood is not reaching, all of a sudden it is dropped, and definitely once it has not got the blood, it will stop working. That is called heart attack. Second, it will trigger to brain also, because brain is also working after getting the blood oxygen there to activate, and the person will become unconscious. And thirdly, it will hit the kidney, because kidney will also be affected. The reason is that once there is excess of vitamin C is ascorbic acid. It is water soluble. It used to flush out. It's not having much problem. But once it is in excess, it will dilate blood vessels, and it will increase the level of oxalate. And once oxalate level is increased in the blood, again it will be the contributing factor to heart and kidney failure. And third factor is that once it is in excess, it can cause some allergy. So this is what happened. Now the other factors are medication. If I say medication, means whether she was on some medication or not, and if she was on some medication, those medicines, they can also interact, and it may cause sudden heart failure or sudden fall of this blood pressure. And also lifestyle is also playing very important role here. If I say lifestyle, means it is directly linked, that is known as metabolic syndrome. Metabolic syndrome means your lifestyle, whether you are having enough sleep, mental tension, oxidative stress, because in this showbiz or in entertainment industry, there is lot of competition, lot of mental tension, lot of oxidative stress, and it is hidden. Sometimes it's very difficult to identify due to this type of competition. It is just like that from outside, the mirror looks very much shining, but if you see from backside, it is totally black. So that is also one of the reason and factor of getting such a sudden heart attack. And also the other factors are that is related to the vitamin C acidity. You know, we human beings are fluid. Our body is with electrolyte, different type of ions, oxalate ions, and is protein, molecule, amino acid, water, all these things are there, and certain pH level is maintained, and our blood is slightly alkaline and a different viscosity, that is called blood chemistry. And once anything excess is taken, and once it is really in excess, may cause some slight change in our blood chemistry, because our blood is alkaline, slightly alkaline, it is 7.35 to 7.45, and if lot of excess ascorbic acid in the form of acid is given, of course the blood pH is not disturbed, but your urine will be little bit slightly acidic, and definitely it is going to disturb the viscosity and some ions, electrolytes. That can also one of the triggering factor for this. Anyway, in conclusion, I can say that there should be autopsy and also thorough investigation about the cause and factor. But I am sure that if these two factors are correct, means she was on vitamin C drip and sudden fall of BP, is very clear indication of the triggering factor is excess of vitamin C. So I have given here in the form of summary here. Number one, nowadays the young girls, particularly in their 20s, 30s, may opt for vitamin C drips for various reasons. Nowadays vitamin C drips are becoming very, very common, especially once they feel and understand that their skin is not glowing, is not smooth, and there is some lining or there is some roughness. They will immediately go for vitamin C drip. And the results are: number one, wellness. Wellness covers, it means that they go for glowing skin. Those who are in showbiz, in entertainment industry, vitamin C is believed to improve skin texture, reduce fine lines, and increase collagen. That is, collagen is a type of protein that is very important to maintain the aging process of skin, and it will maintain glowing and smooth skin. That is, production will increase because of vitamin C increase, and giving the skin a radiant glow look. B is detoxification. Vitamin C is powerful antioxidant, and of course it is anti-inflammatory, and it can boost your immune system, and it can detoxify. That is what they understand, and can remove toxins and impurities from the body and promoting overall wellness. C is can boost energy. Vitamin C drips are marked as a way to increase energy level, reduce fatigue, and improve mental clarity. Of course, once vitamin C is given, overall it is powerful antioxidant. It will reduce drastically oxidative stress, and with that, oxygen supply will be there more, and that's why your brain cognitive property, that clarity will be more. Then the next one is antioxidant property. Antioxidant property means it will reduce and clear lot of toxic waste in the form of, I call it, biological rust, that is free radicals, and you will not be having oxidative stress. That is called antioxidant property, and of course it supports immune system. Then number two is vitamin C drip is celebrity culture. It has become culture because of social media. Lot of celebrities, they are recommending, they are requesting that to maintain your healthy skin and that is glowing look, you should go for vitamin C drip. And also here social media is having lot of influence. Then what are the potential side effect of vitamin C drip? The potential side effect is that I have already given. Number one is vasodilation. Vasodilation means it will dilate the blood vessel which is supplying blood to your heart, to your brain, to your kidney, and once it is dilated, drastic fall of blood pressure will be there. And secondly, it will increase the oxalate overload. Oxalate is a type of iron, and once it's overloaded in your blood, your kidney will be very much affected, and other organ like heart and other portions. That's why oxalate overload is also one of the very negative factor, and of course there will be acute allergy also if it is in excess. Number 3, sudden death of young celebrity Shefali in India due to heart attack is a tragic incident. While the exact cause of her heart attack is a tragic incident and the exact cause of her death is not still publicly disclosed, we can only understand the medicinal chemistry and that might have contributory factor. So I have given here in some condensed form the contributed factors might be there. So these contributed factors for her death maybe that is first, sudden blood pressure fall is a very critical condition. A sudden drop in blood pressure can lead inadequate blood flow to vital organs like heart, kidney and brain, and that is one of the main reason of this death. And number 2 is that is vitamin C drip she was given. That is what it is all what news media, electronic media, mass media is reporting. On that basis I have given that these factors are there. Generally vitamin C is considered safe, but high dose administered intravenously IV can cause adverse effect such as that is vasodilation, means the vessels which are supplying blood to heart will be dilated and drastically blood pressure will fall. Third is potential underlying factors may be there. Those potential underlying factors are maybe pre-existing medical condition. We don't know whether she was suffering from oxidative stress, mental tension and some other metabolic syndrome. That is also one of the contributory factor. And number 2 is medication interaction. We don't know whether she was on some medication, because if she was on some medication and at the same time the vitamin C drip is given to her, it will interact and there will be formation of some intermediate and all the reactions may cause one of the triggering factor of allergy. And then number 3 is poor diet and less sleep. If I say diet, it should be balanced diet, rich diet, poor diet, no. All the ingredients should be balanced like protein, carbohydrate, fat, mineral and vitamins. And mostly many celebrities just to maintain the body, sometimes they are not taking the balanced diet, rather they have poor diet and also they have poor sleep. Poor sleep is also one of the very important contributory factor of heart problem or even overall wellness of any body. Then her lifestyle factor, what type of her life was there means that is called metabolic syndrome. Metabolic syndrome means all are related to that, her obesity, her muscles, her all blood circulation, all the microbes means prebiotic, probiotic bacteria, their balance in intestine, all factors are involved. That is called lifestyle and metabolic syndrome. Might have played a role in SHEFALI'S sudden death by heart attack, that is organ failure. Although investigation and autopsy reports are very necessary to determine the exact cause of her sudden death by heart attack. It is unfortunate for her family members, and I wish them to develop courage to bear such type of loss of nearest and dearest. Once again, thank you very much for watching the lecture.